This video is an introduction to PICO questions, which is really one of the fundamental pieces of evidence-based practice. In this presentation, we will briefly review what evidence-based practice, or EBP, is, define what a PICO question is and how these relate, and then we'll describe a strategy for how to create a PICO question. I'm saying a strategy because there are many ways to arrive at a PICO question, but this is just one way that can be really helpful as a nursing student in this course. So first, when we look at EBP, evidence-based practice, remember that when we base our practice on evidence-based practice, that it's not the only thing we should be doing. I enter my patient's room or a community or a patient's home, and I'm guided by my expertise. I'm guided by nursing theories and patient preferences, and also the latest research, all rolled into one. Now, nursing practice and evidence-based practice, it's not just taking research and applying it to all of my patients. It's also not taking my best guess and using that as the main guide for my practice. We need to consider what studies have been done that help us learn more about our patient population and see how, or even if, the findings from those studies are relevant and appropriate for our patient. And most importantly, if my patient even wants that type of care. Also, I may have found some research that perfectly describes my patient situation, and I'm so excited because I'm thinking this study's results, they're going to give me the answer for what type of care is going to work best for my patient, and I'm so excited. But wait, maybe that study was not conducted well, or maybe the way they measured those results is not reliable. Maybe I can't trust these results, and therefore I should not use those and apply them to my patient. Or maybe I kind of can, but I kind of can't. So you can see how there is some potential for serious gray area as well. This is evidence-based practice. And rather than telling you to just go out and read, research, and apply that to your nursing practice, this process needs to be much more targeted. We need you to focus on a specific issue, especially as you're first learning about evidence-based practice. And this targeting and this specificity is really where the PICO question comes in and what we'll be discussing in this presentation. So if my nursing practice should be informed by evidence, which basically means we have some kind of proof or something that supports what I'm doing, it's a good idea, and that means that there's been a study done on it or research has been conducted on that topic, then I need to find that research. I need to find that evidence. So research, which remember, now that you are in a BSN nursing program, that research term does not mean Googling something to learn more about it. Research is an actual study. A scientist or group of scientists thoughtfully and intentionally planned out a study to discover something new. And there are a lot of different types of research as you're learning in this course, so many that we will not even get to all of them. But for the purposes of this course and this assignment and answering your PICO questions, you're really going to be zeroing in on specific types of research. Single quantitative studies or single qualitative studies. And these are also called primary studies. So the article that you read that they wrote about this study, that article will tell you about how they recruited participants, how they collected data, how they analyzed that data, and then they'll share what they discovered from conducting this primary study. So remember, not all research is primary research. There is also really useful and really important secondary research. So this is systematic reviews, integrative reviews, meta-analyses, metasyntheses. We won't get into the nuts and bolts of these types of research in this course, but think of these as research about prior research. So they aren't telling you about a single study. They're reviewing and analyzing and studying multiple single studies. So those secondary studies, secondary research, very important, have a huge role in your nursing practice, but that is not what you will be using and what you will be critiquing in this class. So remember that there are also a lot of scholarly and useful and important sources out there that are not research as well. So things like quality improvement projects and literature reviews and editorials. These are great pieces of information, but they are not discussing primary research, so these would also not work. So again, the main take-home point here is for this class, to answer your specific PICO question, you need to find primary research, a single qualitative study or a single quantitative study. So I keep mentioning this PICO question. What is it? How do you write one? How do you go about creating one? Well, PICO stands for population, intervention, comparison, outcome, and a silent T for time frame. Now this T is optional, that's why it's in parentheses, and you really don't need to use it unless it applies, so not just for the sake of using it. In some cases, a time frame will be necessary and relevant, and in others, it'll only restrict the research that you can use and really seem more arbitrary. In those cases, you really don't need a T or a time frame. So in this example, we have a population of interest as Somali refugees with type 2 diabetes, an intervention of aerobic exercise, a comparison of standard care, and the outcome of interest as glycemic control. So let's take a step back. With this question, I'm asking, in this population I'm interested in these Somali refugees who have type 2 diabetes, how does the thing I want to do to help them, this nursing intervention of aerobic exercise, compared to what we normally do, or standard care, how does that affect these patients' blood glucose and their ability to control their blood glucose? So you'll notice here that there's no T, and if I had added over 3 years or over 1 month to the end of this question, that would have given an example of a T for time frame. But why 3 months or why 1 year? So in this case, I want to leave this more open so that I can include research that has a variety of time frames, and there's not really a significant value to restricting me to a time frame. Once I add a specific time frame, only research that has had that specific time frame can be helpful in answering my question. One way to approach PICO questions, and again, this is just one way, is to think about what you're interested in terms of when you're going to take care of patients when you get into nursing practice, or maybe even a disease process or a condition that you're really passionate about. So maybe the reason I wanted to be a nurse was because I had a volunteer experience at a nonprofit where I worked with refugees from Somalia. And I kept noticing that those that had type 2 diabetes had really poor glycemic control. And every time they came in, I would see blood sugars in the 300s. And now I'm sitting in my NUR 315 class thinking, I want to help them. I want to know what nurses can do to make this better, to address this problem. So with that, I've identified my population, my P, my Somali refugees with type 2 diabetes, and I've started to paint a picture of where this could go. I'm interested in their diabetic health, but I haven't really put that into my letters, my I, C, O, or T yet. So I'm clearly interested in this population and how they manage and maintain their diabetes and their diabetic health. So that sounds like an outcome, right? That's something I want to happen, is their diabetic health to get better. What do I want to see as a result of helping or intervening with this population? Well, let's take a look at the remaining letters of my PICO question. So my I, or intervention, that's really asking, what can nurses do to help this population? And my O is asking me, how will I know I have helped them? What outcome am I going to look at to see, did that intervention work? Yes, this nursing intervention was successful, or no, this intervention was not successful. So in this specific example, it looks like I was really passionate about my population and the fact that they had trouble managing their diabetes. So I want to know that in some way, shape, or form, I want to help them better manage their diabetes. And that's my outcome, their diabetic health. So what do I want to address? What do I want to get better? Now I begin to brainstorm. How could I define that thing that I want to measure, that diabetic health? Well, diabetic health can be measured in a lot of ways. Diabetes distress is something we can look at, the distress caused by having diabetes, hemoglobin A1C levels, fasting blood glucose. Maybe I want to know about their diabetic health from the complications that they've had from diabetes. So as I think about these, I might come up with a term that maybe captures one or two of them and is still very specific. So here the term glycemic control actually relates to both A1C and fasting blood glucose, but it's still very measurable and clear cut. It gives me a little flexibility though. So I just came up with my O, glycemic control. That's the thing I want to measure to know whether or not I've helped my population. Now notice I didn't say diabetic health or well-being. Those are really, really fundamental, important nursing terms, but how do you measure them? Well, health is actually very subjective, so is well-being. Even diabetic health can be interpreted in many, many ways. So you want your outcome to be very clear and concrete, something that can be definitively measured without leaving too much open for interpretation. Now I'm pausing here because this is one of the most common errors that we see with PICO questions. An O that is not really measurable, or it's subject to a lot of interpretation. It's too broad, for example, and it could be interpreted in a lot of different ways. So really make sure your O, your outcome, is very measurable and concrete. Okay, so now I know who I care about, who I'm interested in, my P, population. And I know I want to affect them. I want to improve something. That's my O. That's something I want to improve. But I still need to identify what I'm going to do as a nurse to help this population. That's my I, my intervention. Now, a key correction here to make: a nursing intervention. There are plenty of things I can do and that can be done to a patient and patient populations, but what is something that's within every nurse's scope of practice that could help my P, patient population, in improving the O, the outcome? Now, what can a nurse do to help Somali refugees with type 2 diabetes improve their glycemic control? This can be the challenging part of the PICO question process. What can nurses do? What can't nurses do? Well, we can do a lot, and I've listed just a few ideas here, but this is actually very, very limited. We're looking at the nursing scope of practice and something that a registered nurse could do without a physician's prescription or physician's orders. So a little caveat here, we are not looking at nurse practitioner scope of practice, we're looking at registered nurses. And some obvious choices for interventions that are not nursing are any and every type of medication. So remember, we do not prescribe as nurses, we administer medications. We also don't perform surgeries or specific surgical techniques. If it requires a medical license or even a prescription, it is not in a nursing scope of practice as a nursing intervention. So you might start to feel a little stuck in this section because you're not nurses yet, and you may not be aware of all the possible nursing interventions that exist. So this is where it can be really, really helpful to start hunting through the nursing research. What are nurses doing to help these types of patients with this specific problem or outcome? So get some ideas from that existing nursing research. Or maybe you had a personal experience with a specific intervention, maybe in clinical or maybe personally. But when in doubt, you can always reach out to your faculty to verify, is this a nursing intervention or not? And there can be some tricky gray area here as well, so we're always willing to chat with you about what qualifies as a nursing intervention. So now let's say I looked at some nursing research on Somali refugees with type 2 diabetes and found that nurses are encouraging physical activity to help promote better glycemic control. So I can begin to fine-tune my PICO question, and it should be based on the available research. In this case, I chose to say aerobic exercise as my nursing intervention. Now you might say, a nurse can't aerobic exercise a patient. And you're right in a literal sense, but we can make those recommendations to patients and support them as they perform aerobic exercise. So it actually would qualify as a nursing intervention. So now let's look at what letters are left. We have C and T. So in order to know if aerobic exercise, my intervention, is making a meaningful impact on the O, the glycemic control, I need to know if it works better or worse than something else. And most commonly, we just compare to what we're already doing. This is why we commonly recommend standard care or care as usual for the comparison. Now, as mentioned before, if time does not add meaning to your question or is not necessary, there is no reason to add this on to the end. So now we come back to the fully developed PICO question. In Somali refugees with type 2 diabetes, how does aerobic exercise compared to standard care affect glycemic control? So you can see how we arrived there. And again, that is just one way that you can arrive at a PICO question. There are other approaches that we'll discuss in class. So in closing here, I just want to discuss some of the common areas where we see students make mistakes or just frankly where we find ourselves getting a lot of feedback. So in the P, in the population section, some students will select a population that is way too broad, like adults or children or women. These are huge populations and there's a lot of variance within each one. So instead of adults, I might say middle-aged Latino adults, or instead of children, I might say adolescents, or instead of women, I might say women with breast cancer. So you want to be as specific as possible, for your population, without being so specific that there isn't any research on that super specific population. Now, for the I, or intervention, I've already kind of touched on this, but we often see students who want to know whether one medication is more effective than the other. Obviously, that's a medical intervention. Another issue with the I is if it's not even an intervention. So here's an example of a PICO question that is basically including an I that's not an intervention. In adults aged 20 to 30, how does childhood trauma compared to standard care affect suicide rates? So this is a very interesting and very important issue, but it's not a PICO question. The I here technically is childhood trauma. I can't watch a nurse childhood trauma a patient, and it's definitely not intending to make things better for the patient. So in this case, I'm actually interested in something that has just happened to a population, not what a nurse can do to help them. So that's why it's not a PICO question. So when in doubt, if you want to know if you have a true intervention for your eye in your PICO, ask yourself, could I watch a nurse walk up to a patient and do this thing? Can I observe it? Is it an action within a nurse's scope of practice that could help someone? And then last here with the O, or the outcome, I've already discussed this too, but often we see outcomes that are really, really broad and open to interpretation, like health, for example. So you need to select something that's concrete and measurable and objective. So one last thing to remember as you work on your PICO questions, first of all, this is a long process. It can take a long time to fine-tune and play with your PICO question, and that's often because you're creating your PICO question in conjunction with reviewing the available nursing research. You're asking a question that you want an answer to, and the answer should be in the available research. So if you create such an obscure or frankly really unique and awesome question, but nobody has conducted any research on it, then it's not going to work. It can help to maybe dig around in the available nursing research about your topic to help you kind of create your PICO question so it can actually be answered.